My name is Dr. Beniaminovitz, and my primary concern in cardiology is really prevention. And the way I look at prevention is essentially you can attack it on three fronts. One, knowing your family history. Two, knowing your genetic history. And three, imaging to see what your actual risk is at this present moment. Your genetic history is something that you get through talking to your family, knowing whether or not you had early heart attacks in your family, as well as hyperlipidemia or certain other genetic disorders, certain congenital disorders. There will be a test available hopefully in the next 2 years or so called a polygenetic risk score, where we'll be able to actually take some blood and from there discern or determine what your actual genetic risk is for having a major coronary event. The second thing that I really do like to focus on is essentially imaging to see what your current cardiovascular risk is. So the way we do that is by multiple modalities. One of them is sonogram here, where we actually do an echo. We see if you have any congenital abnormalities. We see if your heart's okay, if you've ever had a heart attack. We do stress testing here in order to see if you have any predispositions to abnormal heart rhythms, as well as any predispositions to maybe suffering some kind of heart attack. We do calcium scoring, CT angiograms, and other testing to really hone in on what your individual risk is. And the other thing that we like to do is really focus on how to modify those risks once we find them. Our bedrock to modifying risks are essentially lifestyle first. So if you're someone that has a predisposition towards high cholesterol and or cardiovascular disease, we really try to tailor our treatment to you to actually optimize your lifestyle with exercise and optimal diet. And if necessary, we do use the most appropriate medications at good doses to really try to minimize your risk. Our whole concept here is to really prevent cardiovascular disease, so you never have that stroke and you never have that heart attack, and really just try to make sure that you live a happy, thriving life in great health up until your 90s or 100.